the proximal radioulnar joint, participate in the movement of pronation and supination. The distal ends of these two bones, the radius and ulna, articulate with the small bones of the wrist known as the carpal bones, sometimes collectively called the carpus. Each of these carpal bones has a unique structure. It has a name. We're not going to review all of these, but only a few that have high level of clinical significance. The first one of these is a bone that is seen on this side here, on the medial side of the wrist, and is known as the pisiform bone. And it's named after its shape, which is a pea-like. And it is the site for attachment of one of the forearm muscles known as flexor carpi ulnaris. There's another important carpal bone known as the lunate, and it is named because of its shape being a moon-shaped bone, as specifically as it is seen in its lateral profile. This bone, the lunate, is often dislocated from its anatomical position as a result of injury, and it has some consequences with chronic wrist pain. The most important, arguably, the most important carpal bone is this one on this side, which is seen on the radial side here, the scaphoid. It's one of the larger of the carpal bones and is often injured, and in fact results in a fracture through the scaphoid bone, which is sometimes notorious because it doesn't heal very well and can also be a cause for chronic wrist pain and disability. So these are some of the important carpal bones that are often seen in clinical cases, and therefore good to keep in mind. The next set of bones are known as the metacarpals, and they're seen here, 5 in number, 1 for the thumb and then the remaining digits, the fingers. And these articulate at their proximal end with the carpal bones. And their distal ends, these metacarpal bones, articulate with the phalanges. The phalanges are many. They are divided or subclassified into proximal phalanges, as seen here, the middle phalanges, as seen here, and then the distal phalanges, as seen here. Note that the thumb has only 2 phalanges and are named as the proximal and distal phalanges. It does not have a middle phalanx. There are a number of joints. I alluded to the joints between the base of the metacarpal and the carpal bones, and these are collectively known as the carpo-metacarpal joints. There's one at the base of each of these digits. The next set of joints are known as the metacarpophalangeal joints, or the MCP joints, and these are at the distal end of the metacarpals, where they articulate with the bases of the proximal phalanx. The other remaining joints are collectively known as interphalangeal joints. In each of the fingers, we have 2 of these joints. They're known as proximal and distal interphalangeal joints, PIP and DIP. The thumb has only 1 interphalangeal joint and is simply called the interphalangeal joint. It doesn't have a qualifier in terms of being proximal or distal, since there's only 1 joint. Now, each of these digits has a name, and often in clinical practice, one might be tempted to use numerical labeling of these digits, and they're often described as first, second, third, and so on. It's often a recipe for some confusion because for many reasons. One of those reasons is that the number of digits may not always be 5. So if you look at the little diagram in the right upper hand corner, it shows 5 digits at the moment, but it could easily be a patient with 6 digits. And so the confusion is, where do you start numbering? Do you start numbering from the thumb side and then towards the little finger, or in the reverse direction? And so to avoid these confusions in terms of number and the sequence, it's often good practice to use the name that describes the digit. And so you can call the index finger, as seen here, the middle finger, the ring finger, and then the little finger by their names, and then the thumb